Hi, friends. How are you all tonight? I hope you're doing well. I'm doing as well as can be expected. Why do I say as well as can be expected? Because, of course, politics is rotten right now. Of course, it's always rotten. Deborah says she can't see or hear. She said that at 9:03. It's 9:06 now. Can you hear now, Deborah? Dolores says, hi all. Kay says, hi, Dolores. Russ says, evening, Dr. Joe. It's full moon night. So if I may step away early for a moonlight walk. Oh, wow. Different camera? No, same camera. Maybe I've set it a little bit differently, Russ. Is it a little too dark for you? And Deborah Wilson says, yeah. Kay says, hanging in, Joe. Yeah, what, Deborah? Still can't see and hear? Please let me know. It's now 9:07. How's the mic now? Russ says picture and audio great. Okay, that sounds good. Deborah can now hear and see. Wonderful. I'm glad it adjusted. Now, let me see. I see I am a little too dark. Maybe I can easily fix that for you. A little darker than usual in here. So let's get this a little brighter. There we go. How's that? I think that's a little bit better, right? Yeah, a little brighter, huh? Not too bad. Please share as much as you can. We have a lot to cover at night, as usual. I want to start off with the situation with COVID. Okay, of course, I know a lot of you have been following that, but let's take a look at this article from. Okay, let's take a look at this article from Common Dreams. In July, there were some 1.9 million new COVID cases, okay, in the U.S. Right now, after 4 days in August, the case I saw today, okay, number of cases I saw today was 4.9 million. So the July cases were close to 40% of the total in the United States. By the end of July, we were at somewhere around 157,000 deaths. So if you project out, okay, the death rates by just 1 month, you project out the death rate and the case rate, okay, just by 1 month. Assume that there's a lag of a month between the case occurrence, okay, and deaths, which seems to be roughly the case. actually one way or another, because it takes a while for the symptoms to be noticed. Then there's a treatment period, and then there's a time in the hospital, and so on. Might be 3 weeks to a month in terms of lag time here. So you're going to start getting the fatalities from the cases in July. Well, you started getting them now, but they're going to probably continue through the remainder, okay, of August. So if 40% of the cases were in July, you can probably figure that 40% of the deaths are going to occur. Okay, in August, there are about 157,000 deaths. So you can pretty well figure that by the end of August, we're going to be at 220,000 deaths. So we've got a pretty good chance, even if we cut back on the number of deaths in September and October, we have a pretty good chance of hitting 260,000 deaths by the end of October as we approach November 3rd. And I think the majority of people, the heavy majority of people right now, are blaming the intensity of the COVID crisis. Most of the difficulties we have in the COVID crisis on the administration's handling of the problem. The politicization of the problem, the failure to take the problem seriously, the failure to move fast, the failure to listen to scientific opinion, to follow scientific opinion and the recommendations of the scientists. And what we're seeing, according to the Common Dreams article here, is the spreading of COVID all over the United States. You've probably heard that Dr. Deborah Birx said to CNN on Sunday that it is extraordinarily widespread. And it is extraordinarily widespread. And a lot of people are saying it didn't have to be like this. They're calling for a mask mandate, okay, a national mask mandate. And of course, there's the call for increased testing, contact tracing, and for those who will listen, quarantining, okay, and isolation. And of course, the record, okay, of deaths in March, 2 deaths. In April, it had gone up to 4,700, okay, and 80 deaths. By May 1st, it was up to 64,943 deaths. By June, it was up to 105,165 deaths. By July, it was up to 128,062 deaths. And by August 1st, the count here is 154,360 deaths. I think it's an underestimate. From what I've seen from the various sites, I would put it at 157,000 by the 1st of August. But anyway, it's been hitting members of Congress. Crazy Louis Gohmert, of course, was diagnosed with it, and Raul Grijalva was diagnosed as well with it. Okay, Raul is one of the most progressive members of Congress, and Crazy Louis is among the most right-wing members, okay, of Congress. And Grijalva says he's not able to directly blame anyone, but there are some members of Congress who failed to take this crisis seriously, and a lot of the Republican members routinely strut around the Capitol without a mask to selfishly make a political statement to the expense of their colleagues, staff, and their families. And of course, there's much justice in that statement by Raul. And in fact, the Crazy Louis Gohmert was at the hearing that was chaired by Raul Grijalva last week. And Raul, of course, contracted the coronavirus, even though, of course, he was masked at that particular meeting. He was protecting others at that particular meeting, but Louis Gohmert was not protecting him, clearly, and neither were some other Republicans as well. So, but it's not just the Republicans in Congress. It is people all over the United States. You see people working all day. They don't have masks. They interact with customers. The customers speak to them. They speak to the customers. And meanwhile, the virus is getting community spread. Definitely community spread, okay, of the virus. So that's the situation in my estimation, and you'll be able to see if I'm right. But in my estimation, we're looking at 220,000 by the end of August. And I don't think you will hear that anywhere else. The other people are being more cautious, okay, and there is estimation, perhaps thinking it's going to be 30,000 fatalities per month. But I don't think it's going to be 30,000 fatalities, okay, in this month. I think what we have to project is the fatality rate that's occurred so far and project it to the fact that we just had close to 40% of the cases occurring in July, and conclude from that we're likely to get 40% of the fatalities in August. But what about the fact that our treatment methods have improved over these periods of time, and they're more successful in treating people in hospitals? Well, that might have an effect sufficient to cut down fatalities to 30,000, in August. But the reason why I think it's more likely to be 60,000 is because of the spread of the virus into the rural areas of the United States, where so many hospitals and hospital beds are not present. They are not there. Hospitals in the rural areas are few and far between. They may have to start to turn away people from those hospitals. They won't be getting the better hospital care they've been getting in the urban areas thus far. So even though treatment methods have improved, I think the delivery of the treatment methods to the patients now coming in the rural areas will be even less effective than we've seen so far. I think roughly one will compensate for the other, and you have to expect the fatality rate per case to be roughly the same as it's been for the total sample of cases so far. That's why I'm expecting roughly 60,000 new cases this coming month. I may be wrong. I may be too pessimistic. We will have to see. But I'm saying 60,000 new fatalities coming up in August, and we're looking at 220,000. I hope to God that none of us is among one of those fatalities. And I hope to God that I'm wrong as well. Okay. So that's what we're facing. That's what we have to fight. Okay, looking at it in terms of the lag. During August, we have to fight to cut down on the number of new cases so things get much better in September. That's up to us. Now, this idea of opening schools all over the country, this is ridiculous. This is ridiculous, given the number of new cases in July and the expectation for fatalities, in August. we have to be battening down the hatches in August so that things get better in September and things get better in October. Now, Donald Trump may want to go ahead and open up the schools, and the Republican governors may want to go ahead and open up the schools, and they may want to pretend that everything is all right. But as sure as you're born, they're going to pay the price if things don't get better in September and October. Markedly better. Markedly better. If large numbers of people continue to die, then they're toast. Of course, I think they're already toast, which is why they're in such a disorganization. But if they have any chance at all to recover it all, it's not going to happen if things don't become much, much better in September and October. They won't be able to blame it on the Democrats. That's not what's going to happen. So, of course, you know that the Republicans and Democrats have not been able to agree on a new relief bill. And therefore, we now have an eviction crisis. And we now also have a crisis where the economy is about to crater even more than it has been cratering, because the supports for people who work are no longer there. They are no longer there. We know that. It's obvious to all of us. Okay. So let's get into some of those effects. But before we do, I want to go through an article that was written by Reverend William J. Barber II and Reverend Dr. Liz Theoharis. That appeared in Common Dreams. I don't think it originally appeared in Common Dreams. Maybe it did. But the title of it is "Woe to You Who Legislate Evil and Rob the Poor of Their Rights." And the good Reverend, the closest thing to Dr. King we have today, says, on Monday, August 3rd, faith leaders with the Poor People's Campaign will flood Senator McConnell's office and the Senate with calls will flood Senator Mitch McConnell and the Senate with calls saying that it is treacherous and heretical to hold up the Constitution and the Bible while trampling on the right of every person to life, liberty, and the pursuit of happiness. We demand a true relief bill, one that guarantees health care, okay, and an adequate income, protects housing, water, and utilities, and prioritizes the needs of all people, especially the poor, not the wealthy and corporations. They might have added, not the lobbyists either. Indeed, our government's abandonment of the people in the midst of the greatest public health crisis in a century and an economic downturn that could rival the Great Depression. It was just announced, okay, that our GDP fell by an annualized rate of 32.9% in the second quarter of 2020, the greatest collapse of the U.S. economy in a single quarter in history, is sin of the highest order. The ancient words of the prophet Isaiah ring with unnerving relevance today. Quote, "Woe to you who legislate evil, who rob the poor of their rights, making women and homeless children your prey," unquote. This week, as millions edged even closer to the precipice of economic ruin, hunger, sickness, and death, Senate Republicans returned with a proposal that would leave citizens and states with fewer protections and funds. At the heart of the deliberation is a disdain for the poor and for life itself. That is not new, but rather an escalation of the federal response to the coronavirus so far. Yes, the first four pieces of legislation on the pandemic included measures that have helped keep the millions afloat, but that relief was temporary and threadbare. In March and April, Congress, buoyed by Senator Mitch McConnell, was all too willing to quickly push through stimulus packages that prioritized hundreds of billions for the wealthy corporations and the military. No, it was trillions for the wealthy corporations and the military, because that $456 billion for bailing out the wealthy corporations was sent to the Federal Reserve to serve as loss protections for a loan fund, a money cannon of $4.6 trillion that was established for the use of the corporations. $4.6 trillion. This came after the Fed had already injected $1.5 trillion to Wall Street, while leaving tens of millions to fend for themselves. As leaders in Congress still debate the merits of masks and suggest this virus will somehow just go away, Senator McConnell casually stalls and belittles, telling the country that our response should be tailored and targeted, quote unquote. By the way, I saw Senator Thune just today in a statement being made by the Republican senators who talked about tailoring and targeting the response. The very handsome Senator John Thune, one of the future so-called stars of the Republican Party, talking about tailoring and targeting rather than spending what is necessary for people. Senator McConnell continues to double down on the politics of austerity, proposing $200 in plus-up unemployment benefits instead of $600, funds for legal help in the case of evictions, rather than an extension of the federal moratorium on evictions or any form of rent cancellation, and a liability shield for corporations who are knowingly endangering people by forcing them back to work while not even increasing pay for millions of low-wage workers. Republican senators have put out hateful lies, blaming poor people for the nation's botched pandemic response. On the other side of the aisle, Democratic House Majority Leader Steny Hoyer, surely the biggest schmuck in the House on the Democratic side, has already conceded that they're willing to sign a bill with slash unemployment protections, going so far as to repeat the old anti-poor talking point that more robust welfare spending might actually dissuade people from working. Just the point that is made by Mnuchin without a shred of empirical evidence. All the empirical evidence, by the way, shows that the $600 unemployment payments had thus far dissuaded almost no one from working. Going on with the article. Why is it that when the rich are in need, they're never told that they're asking for too much, but when the poor ask for the right to survive, they're met with denigration cloaked in the language of sober pragmatism? We're in uncharted territory. There have now been 19 consecutive weeks of unemployment claims over 1 million, each week more than double the single worst week of the 2007-2008 crisis. Department of Labor reports that over 35 million workers are either on unemployment benefits or have applied for them. This job crisis has devastated Black workers in particular, but it has also wound its way into every corner and community in the country. What this will mean for American life in the years ahead is catastrophic. Already, 27 million people have lost their employer-sponsored insurance during the worst health crisis in at least a century, joining the 87 million people who were already uninsured or underinsured. In June, 30% of all homeowners and renters failed to make housing payments, and massive waves of evictions are projected for the late summer and fall, hitting undocumented folks, poor renters, and people of color first and worst. A study back in March found that if poverty and unemployment reached Great Depression levels, 9.9 million people could join the over 37 million people who faced food insecurity in 2018. A more extreme scenario would raise hunger by over 17 million. It may be hard to believe, but 4 months later, we've now surpassed even that dire metric. Before the pandemic hit, we were a nation riven by poverty and inequality. 140 million of us were poor or low income. Now, the complete failure of leadership in our highest offices have given us the largest COVID-19 death toll in the world, as well as spiking numbers at a time when other nations in both global north and south, with the exception of Brazil and Peru and Chile and some of the other nations in South America, are curbing new cases. And while this virus may eventually be tamed, our government's negligence will likely leave us with years of historic suffering and even longer lasting wounds. This will certainly be true if we continue down the path laid out by McConnell and a Congress obsessed with policy tinkering, one that haggles over the scraps of what millions of Americans actually need to live. This is a time of staggering danger, and also, if we allow it, enormous possibility, which should be met with unbridled imagination and absolute seriousness. Now is the moment when we must challenge the death measurement that is found in every form of our public policy. These are the true stakes today. What the prophets of the Bible have warned empires before. Do we choose life or death? And that is what the Reverend Doctors William J. Barber and Liz Theo-Harris have had to say. What I'd like to add to it is there are bills introduced in Congress which show a bit of imagination. Those include Pramila Jayapal's bill to take care of payroll for everybody, to nationalize payroll in the United States. And the bill being co-sponsored by Rashida Tlaib, introduced by Rashida, and whose chief co-sponsor is Pramila Jayapal. The bill for a basic income of $2,000 per month for every adult man and women in the United States for as long as the crisis should last, and $1,000 per month for every child in the United States as long as the crisis should last. And then $1,000 a month for a year afterwards for every adult in the United States, and $500 a month for every child in the United States. For 1 year thereafter, after the coronavirus crisis is over, that bill to be funded by platinum coins, Those are the most imaginative bills out there to relieve the crisis. And for after the crisis, the most imaginative bill out there is the federal job guarantee bill. That's what's out there to create the transition, the necessary transition. Because what is the coronavirus crisis doing? It is killing businesses, small businesses, permanently. It is destroying them. They won't be back on a permanent basis. The people who worked for those businesses will not be able to find jobs once the crisis is over. We need the job guarantee bill to be passed by then so they can step into job guarantees at a living wage with good fringe benefits until the private sector can come back and employ them again. We need that as a standing program to cushion the shock and to provide a floor for people so that the whole economy does not continue to collapse. So, did I forget to share that one? I'm sorry. I forgot to share that one. Well, I read it anyway. It's pretty cool. So, next, I wanted to go through, or at least talk through, a piece on the eviction crisis entitled, "We Can Stop the Coming Eviction Crisis." And it appeared in Jacobin. And it was written by Karen Badnarevsky on July 30th. It's a few days old now. At the time, she was basically pleading with the Congress to do something about that because the rent was going to come due, and of course is due, has been due on August 1st. She points out, as of early July, over 17 million people were receiving unemployment benefits. Millions more are still waiting to access them or undocumented or otherwise unable to qualify for aid. Even for those who have managed to hang on to their jobs, the threat of eviction looms large. Census data suggests that nationally, over 40% of renter households are struggling or unable to pay rent, which could mean over 11 million evictions in the coming months. Those who are booted from their homes will be more likely to lose their jobs if they haven't already and find it harder to get a new job. They will be forced to double up with friends or family. Vie for a place in an overcrowded shelter or live on the streets, all of which will increase their vulnerability to COVID-19. Yes, evicting people in the middle of a pandemic. What's that going to do to the new cases? What's that going to do to deaths in September and October? What? It's going to accelerate the whole process. If anywhere near the number of potential evictions are actually carried out, millions of people will suffer a devastating blow, prolonging the pain of the pandemic. The metaphors the media typically use to describe the eviction crisis are those of a natural disaster. Quote, an avalanche, unquote, quote, a tsunami, unquote, quote, a flood, unquote. This implies a sense of inevitability. Renters lost income because of the pandemic, therefore they can't pay their rent, therefore they will be evicted. But there's nothing inevitable or intuitive about the fact that millions of people should be thrown out of their homes while corporate landlords like Blackstone continue to rake in the profits. The reasons for this unnatural disaster are clear. Instead of investing in truly affordable housing and enacting nationwide measures to keep people in their homes, we've created a confusing patchwork of means-tested housing assistance and pushed people to compete for scarce units. The recently expired federal eviction moratorium, which was passed as part of the CARES Act, only applies to tenants in homes with federally backed mortgages, about a quarter of all tenants nationally. Republicans have not included the moratorium in federal stimulus bills, and it's unclear whether Democrats will have the leverage or the political will to negotiate its extension. Many of the tenants were excluded from the CARES Act because they weren't in federal housing, have been relying on legislation from state and local governments. The statewide moratoria are a confusing patchwork in and of themselves. In some places, the government enforces them, in others, the courts do. California has enabled local governments to extend the state moratorium. It expired at the end of May. So tenants' risk of eviction varies by city. New York, isn't that ridiculous? But New York has prevented landlords from removing tenants, but allows courts to impose money judgments for overdue rents. And they all expire on arbitrary dates, after which tenants will be expected to magically have steady jobs and full bank accounts. And as I just said, people, many, many, many millions and millions of people are not going to have steady jobs again unless and until we have that job guarantee program passed. Until we have that job guarantee program passed. We need that passed. In some states, tenants must prove they have lost income due to COVID-19 as a defense against eviction. This assumes that the purpose of an eviction moratorium is to protect otherwise, quote, deserving, unquote, tenants who've seen their incomes drop because of the pandemic. But what about tenants who were cash-strapped before COVID-19 due to, say, medical bills? What about those who are evicted for a cause other than non-payment of rent? The devastating consequences of eviction on economic, mental, and physical well-being, even during normal times, are amply documented. The purpose of a moratorium should be to prevent anyone from becoming homeless during a terrifying public health crisis and unprecedented economic collapse, whether or not that collapse led directly to their job loss. And the cataclysmic effects of the moratorium's expiration should make us reconsider whether evictions should be part of the reality of life in this country for so many people. In mid-April, Representative Ilhan Omar introduced legislation to cancel rents and mortgages for the duration of the public health crisis. The legislation would also offer financial relief to tenants and small landlords and establish a fund to finance the purchase of private rental housing by local governments, public housing authorities, nonprofits, and community land trusts. In addition to its legislative co-sponsors, the bill has been endorsed by over 36 community and labor organizations. A statement on Omar's website emphasizes that due to layoffs and mass unemployment, renters and mortgage holders are accruing mountains of debt, despite many not having a steady income for the foreseeable future. We must take bold action now that extends the same financial assistance and protections to our struggling citizens as has been offered to profit-driven corporations, unquote. Exactly. Precisely. Unlike many of the mitigation proposals advanced by other lawmakers, Omar's bill not only addresses the cause of the current eviction crisis, but lays out a path to eliminating housing insecurity and ensuring housing as a right. That's exactly the right approach, she says. Unless we cancel rent and mortgage obligations during the pandemic and enact policies to guarantee housing for all, we will be placing the burden of the coronavirus epidemic on those who can least afford it. Not just the financial burden, but the health burden of the coronavirus pandemic. Because if people are on the street, they're going to be much more subject to the coronavirus pandemic. And they won't be able to isolate, and they won't be able to quarantine when they need to isolate and quarantine. And if we put together any contact tracing, isolation, and quarantine program for people, how can it apply to those who don't have homes, who don't have housing? We need to have people in homes to get over the coronavirus crisis. What the Congress has done is to endanger our health further by allowing the moratorium to expire. It is not an issue of whether landlords get their way, of whether they can be made whole, of whether the renters are able to pay or are not able to pay. It is a health and safety issue for everybody. People have to be in their homes, and Congress blew it. They blew it by not extending the eviction moratorium. They absolutely blew it. Next, I'll talk my way through some unsanitized columns because there were a couple of great ones since I've been last on, a couple of good ones anyway. Let's talk about why a relief bill is elusive this time. In other words, why the battle with the economics impact of the COVID virus is not being won by legislation that is coming through Congress. Let us do that. Okay, this was written by Dave Dayen on August 3rd, yesterday, Monday. It's entitled, Why a Relief Bill is So Elusive This Time. I did a short video, my own on this that I have yet to post up. Oh, by the way, I began posting short videos up with my first one at roughly 7 o'clock this evening. It was about the claim being made by some that Karen Bass is disqualified as a candidate for vice president because she gave an address in 2010, just a few minutes address at a dedication of a Scientology church in her district in California about 10 years ago. I think that is absolutely ridiculous. And the short video was on why it's absolutely ridiculous. And why is because Kamala Harris. That's the short answer. You have to go to the video for the long answer, which is not very long because it's a progressive short take. It's one of my new progressive short takes. So Dave starts. Back in March, Senate Republicans put together, this is by Dave Dayen. He says, back in March, Senate Republicans put together a fairly partisan bill to respond to the coronavirus. Of course, Democrats got changes to that bill, and there's a compromise. The legislation passed. And we've been over that legislation here, and we've been over criticisms of that particular legislation. However, this time around, the Senate Republicans put together another very partisan bill, but a couple of weeks later, we're nowhere near an agreement. There was a lot of finger-pointing on the Sunday shows. There was a lot of finger-pointing yesterday and a lot of finger-pointing today. But he says it was notably intense on the Sunday shows, and Mitch McConnell has completely disconnected as the White House and Democratic leaders negotiate. The White House has explored unilaterally extending unemployment benefits, which they can't really do. They can't do it at all. Such is their frustration with failing to reach agreement. This has surprised a few people. Congressional Republicans still have an election to run in November, after all. A depression would presumably be catastrophic to their hopes. A depression would be, not to mention, though, these continuing huge numbers of deaths from COVID-19. But they've asked, don't they still have any interest in preventing widespread suffering? He says, in their mind, they have prevented widespread suffering. The suffering on Wall Street has been lifted. God save the Republic. He didn't say that. On the day that expanded unemployment benefits expired last Friday, the stock market rose. It's back up again today. God save the stock market. As we know, this is the cause of an ironclad vow from the Federal Reserve to do whatever it takes to protect asset prices. And a 4.5, I think it's 4.6 trillion dollar money cannon facilitated by Congress to back up the promise. The corporate bailout was the rescue Republicans wanted. It was valuable to them, and they were willing to give up a lot to get it. But Democrats secured some pretty good terms, but they were all temporary, and now they've mostly expired. The Fed money cannon, you will note, has not. In the second round, the Democrats want a lot more, 3.5 trillion worth, if you see the HEROES Act as their opening bid. But the Republicans already got their corporate bailout. That was the moment of highest possible leverage for the Democrats in March. And guess what, folks? Nancy Pelosi blew it, assuring people that, oh, later on we'll be better able to get it. Later on we'll be able to get it. Well, she was correct to the extent that there's now more leverage and building leverage than there has been since March. But the leverage is now being built at the expense of people in spades with this eviction crisis and with people suddenly losing the extra unemployment of $600 a week. That was the moment of highest possible leverage. Now, there may be a moment coming again when the leverage is even higher, but people are going to be suffering hugely by then. So Pelosi should have maximized the March moment instead of rushing it through as she did. She might have had a better moment then if she had passed a bill allowing the House Democrats to meet online through Zoom at that time. But no, she wouldn't allow that. She wouldn't allow online meetings at that time. People had to come to Washington at a time when they could not, when COVID was raging. So there was a small skeleton crew on the floor of Congress, and she ran everything. And she didn't have people telling her, well, what about this, and what about that, and what about the other? That's why she negotiated so badly, because she wanted to do everything alone with nobody else interfering, pushing her to do it better. Republicans, or at least Senator McConnell, would like to give corporations total immunity from any negligence lawsuit over infecting workers and customers. You've already heard what I've said about that and what Reverend Barber and Theo Harris have said about that. But it's more of a nice to have than a must have, says Dave. Well, McConnell at the beginning was talking about it like it's a red line, okay, like it's a must have. Now, it is true that now he seems to have toned down a bit and has not been calling for it quite as vigorously lately. But Dave says they already have the Supreme Court, after all. So it's more of a nice to have than a must have. So the deal, they also already have the federal courts because of all the court packing that's been going on by the Trump administration, facilitated by Mitch McConnell. So the deal isn't coming together, Dave says, as easily this time because you have a serious balance between what each side actually wants. Quote, but the election, you might ask. Well, Republicans know they're cooked in the election. They can read a poll. They can see the death count. They know who Donald Trump is and that suppressing the virus is something he can't BS his way through. There are two choices here. Try to salvage the election in a probably fruitless attempt, or saddle the next president with a depression and immediately shift to deficit mongering to constrain the response and win in 2022 and 2024. So they plan to do to Biden, he's suggesting, a lot of them are probably planning to do to Biden what Senator McConnell and other Republicans did to Obama during his first term that led to their victory in 2010. They're taking over the House then and then hamstringing anything that he might want to do except austerity between 2010 and 2011 and 2016. Opting for the latter probably isn't unilateral among Republicans, but it doesn't have to be. If enough Republicans are looking past this year, that's enough to crush their negotiating position. since at least some Republicans, those who are standing for election, are required to find a compromise, having them check out of this makes a deal elusive. All of this is to say that Democrats had really one shot to maximize the relief measures back in March. And I agree with Dave on this. At that point, they could have ensured that there wasn't an imbalance between temporary individual measures and permanent corporate ones. That was the time to ensure money for the Postal Service and the elections. That was the time for significant state and local relief commensurate with the scale of the problem, with no strings attached. There were many of us urging Democrats to up the ante on their asks because the leverage would go away after the corporations were taken care of. But here we are. I haven't been arguing that the CARES Act was a bad bill in hindsight, but in foresight. I looked a little bit down the road and saw this disaster unfolding. I saw that the design of the CARES Act was going to lead to premature reopenings. I saw that Donald Trump was the president and a well-managed conclusion to the coronavirus wouldn't be possible. I'm not a clairvoyant, and it didn't take one to see these problems. It required only a simple appreciation of negotiating leverage and an ability to look over the horizon. Nobody did, certainly not Nancy Pelosi, and here we are. Here we are. And Dave points out, we're going to get monthly job numbers on Friday, and estimates have been so far off during the pandemic that the outcome is really unknown. But at least one set of numbers will be quite distorted. Specifically, the hiring of teachers in July will show a surge of about 850,000, give or take. Obviously, 850,000 teachers weren't hired last month. And to be clear, this just takes things back to the normal level of teachers, meaning the job loss previously was overemphasized. But when that headline jobs number comes out, it's going to include this phantom teacher hiring surge. That's based on a seasonal adjustment that this year is a little bit skewed. And Dave then points to the Sturgis Rally. It's a massive biker event in South Dakota. Back in his TV editing days, he once worked on a show about it. The Week Plus event starts August 7th, brings in bikers from around the country. Over 250,000 people are expected. This is in just a few days, about half as many as normal. Though since it's literally the only major gathering of its kind in the U.S. since March, that number could go a fair bit higher. Maybe I'll be pleasantly surprised, but my assumption is you'll be able to count the masks on one hand. Should have said on the fingers of one hand. Sturgis has apparently become more upscale in recent years, with affluent biker enthusiasts joining the fray. This is probably a case of having no way to cancel this thing, even if you officially canceled it. And so starting this Friday, hundreds of thousands of people are going to come together in one campground during the pandemic. Yikes. Yikes, indeed. What's going to happen at that campground? Clusters are going to be created, and then the bikers are going to be going home, spreading the COVID that they contracted while at Sturgis, and they'll be going home to all parts of the United States, probably a lot of rural areas, bringing COVID to them. More COVID to the rural areas where they can't possibly cope. Yes, there is incredible progress on a vaccine. There's a lot of progress when it comes to therapeutics on COVID, as well. But that progress is not going to be effective in the next few months. There's no way to deliver stuff to people in the next few months that's going to make a material difference. August, September, October. And there's another unsanitized piece today from David. That's another excellent piece. And let me share it with you now. Sunday and Monday are the typical slow days for counting coronavirus cases, hospitalizations, and death. We will have to brace for today's results for the full trend. But based on current data, which, as I've said repeatedly, is a lot like the blind man feeling an elephant, though it can show trends, cases and hospitalizations are trending down. Deaths, you would expect to have another week or so of increases. No, Dave. No. It's more than another week before they begin to trend down. As I say, the whole month of July has to be reckoned with now, in August. Even if the cases are starting to go down now in certain areas, and I believe it's correct to say the cases are, it's also true that until very recently in July, the cases have been going up precipitously. And you have these events in August coming up. Basically, the school reopening still coming up. The Sturgis event coming up. People still going on vacation. How are they going to isolate when they go on vacation? How are they going to socially distance properly when they go on vacation? Where are they going on vacation? Are they going to parks in Tennessee where they don't socially distance at all? How about all the people who won't wear masks in Texas when they go to parks? How about the Florida people who are still fooling around when it comes to mask wearing? The Trump Veep sketch was embarrassing, but near the end, he does mention that deaths were going down in Arizona, Florida, and Texas. It's better to say that these states have plateaued on deaths and seen a sustained drop in cases, though testing is also lower, and hospitalizations, but in general, there is a softening in the data. These trends could be reversed, but they hold for a lot of states with major outbreaks, like California. The death rise will likely continue for a little while, but with hospitalizations falling, official deaths are probably going to fall as well. If this wave does top out at a high of 1,500 or so deaths per day, that is a significant reduction from the 2,500 we saw in April. That does suggest better medical care, saved lives, which is a good thing, though obviously there are a host of bad outcomes from coronavirus that fall short of immediate death. Of course, the whole country cannot breathe more easily now. It's wrong to look at national cases in a country this fast with different outbreak timelines. We are sadly likely to have these waves of hot spots and cold spots until there's a vaccine in widespread use. For example, Ohio, Tennessee, Georgia, Oklahoma, and Kentucky are in a plateau at a high level. Idaho and Arkansas hospitalizations are rising without end. Alabama and Mississippi have raised concerns. All of these states have large rural areas, and that's where the trend of improved medical care could reverse itself. And as this study in Health Affairs shows, it's a story about inequality, and Dave links to a study in Health Affairs Journal. And he says, the study concerns intensive care unit beds, ICUs, a critical part of COVID-19 care. If you have a secure facility to administer to a patient, there's a better chance of survival. But because America is America, there's a critical shortage of ICU beds in precisely the places that need them the most right now. That is in Trump country. Poor rural communities, they're often too far from wealthy areas to transfer patients. According to the Health Affairs study, 49% of the lowest income communities had no ICU beds. whereas only 3% of the highest income communities had no ICU beds. And this disparity was even sharper in rural areas, which again don't have a richer community next door to which they can offload patients. We're seeing this in the Rio Grande Valley in Texas, home to 1.3 million residents and no public hospital. Starr County is one of the only counties in America to have to resort to triage, choosing who to care for and who to send home to die. The conversion of hospital facilities into ICUs is ongoing, but often too late. Rural hospitals, of course, are in total crisis in the U.S., with 19 closures last year and 120 since 2010. Thanks, Obama and Trump and Congress, as hospital networks consolidate and strive for even greater profits. Rural hospitals that fail to, and thanks capitalism, rural hospitals that fail to bring in the necessary revenue fall away. This is where the virus is headed, into areas that are utterly unprepared for a crisis of this nature. That's because America remains a place where your medical care is a function of your socioeconomic status. This essential inhumanity should have been remedied long ago, but the crisis makes it impossible to look away. We have the greatest health system in the world if you can afford it. That's a moral crime. Single payers, says Dave. I say too, that's a moral crime. Single payer supporters are often derided as unrealistic, but it's actually unrealistic to expect that Americans will blandly accept their bank accounts being a factor in their mortality. I think that's a very good line. It's actually unrealistic to expect that Americans will blandly accept their bank accounts being a factor in their mortality. This must change. Before it can change, though, Dave, they have to understand that their bank accounts are a factor in their mortality, in spite of all the people who have died over the years between 2010 and 2020 due to lack of health insurance, to lack of being able to pay for health insurance, to get on health insurance so you can have care, to have a good enough health insurance policy that you can get good care and continue to get it. It's still true that Americans have not come to the realization that their mortality depends on their bank accounts and that they have to change this. I'm surprised that did not become a slogan in Bernie Sanders' campaign. Right now, your mortality depends on your bank account. Do you want it to continue this way, or do you want to have health care as a right under Medicare for all? 1/3. That's the percentage of small businesses in New York City that could close up shop due to the pandemic, according to the Partnership for New York City. That's 80,000 businesses alone in New York City alone. Dave says the working number I've seen for closures so far is 100,000 for the whole country. What Dave is saying here is that's a gross underestimate because there are 80,000 in New York City alone. Dave says, I don't have similar numbers for my hometown in Los Angeles. But here's a long and updating list of closed restaurants. And he links to that list. He links to that list in LA. My daughter lives in LA now, as many of you know. Anyway, there is a list of those restaurants permanently closed restaurants that you can access from his article which I've linked to, okay, in the description. So okay, the list is a relatively small list of well-loved restaurants. Okay, it's not a count, but I gather these restaurants are well-known and well-loved, okay, in LA. And this is an article by somebody who was mourning the passing, okay, of these restaurants. This is from Due LA Magazine. So I leave you to access that for yourself, okay, and read about it. I'm sure, okay, it's very interesting. I've been told that downtown Washington, near the Prospect offices, is a ghost town. I have to say, I haven't been to downtown Washington, even though I'm only, 35 miles away or something like that, maybe not even that much, for a long time. But I can well believe that going out to lunch restaurants in downtown now, if you go out to lunch, you're going out to a ghost town. There are probably very few restaurants that are still open. It's in many ways not surprising that a small business program that had 8 weeks of payroll covered didn't last in a crisis well into its fifth month. And by in many ways, I mean in every way. This is another example of the temporary benefits of the CARES Act set against the effectively permanent bailout authority for large corporations. There was certainly a way to have the corporate credit facilities run by the Fed expire on the same date that unemployment benefits and all the other pieces expired. That way, there would have been incentive on all sides to extend them. I don't support the Fed facilities, but at least that would be a politically balanced way to ensure a stake in the outcome on all sides. Now you have Mitch McConnell lamenting that 20 of his senators will never vote for anything, and a party simply disinvested in desperately needed relief for working people. Not even just poor working people, but middle-class working people too, who do not have jobs right now and who have big mortgages to pay or who have substantially expensive apartments. So you're asked why everything's so. If you're asked why everything's a Taco Bell or Amazon Ghost Store in 20 years, remember this aspect of it. And then Dave moves on to mail service. A disruption of mail service across the country as the new Postmaster General bans overtime and instructs postal workers to leave behind mail is coming so close to a presidential election that will have a heavy vote by mail element that you can't help but assume that this is the ultimate goal. I would say it's a happy byproduct of a bid to delegitimize the post office and warm the public mood towards privatization. The USPS had high marks for service and trust before now, making it the DMV of conservative fever dreams, makes it easier to kill, and the pandemic provided the opportunity. Now, seeing Trump assert that mail-in voting can't be done now that he broke the post office certainly suggests opportunism, but the immediate impact of that will evaporate the traditional Republican advantage on mail-in voting. It will make things worse for him and his party, and the Postmaster General serves at the pleasure of the president. So the next one can throw out the Trump donor currently running the USPS into the ground. Just another thing to do on day one. So where does that actually leave us? Where it leaves us is I can see the ads. I can see the ads from Democrats right now. You know that the Republicans, okay, and Donald Trump have refused to bail out the post office. Why have they refused to bail out the post office? Why have they done that? They've done that because they're trying to force you to either not vote and throw Trump out or take your life in your hands by going to vote when the pandemic is still raging. They're forcing you to take your life in your hands to get rid of this monster that you now want to get rid of more than anything in the world. This is a deliberate plan by the Republicans. This is what they're doing. Does this party continue to deserve to exist? Do any of their candidates deserve to be elected in this election? Answer the question. They're trying to take away your vote by putting your life at risk, by forcing you into risking your life in order to vote so that you can eat, so that you can be employed, so that you can take care of your family, so that you can educate your kids. That's where we are. The ads almost write themselves. I know people keep saying, well, Trump's going to pull something out of the hat. He can still win in this state. He can still turn around in that state, in the other state. I say, I just don't agree. I think that's baloney sausage. I think it's too far gone. If they don't make a deal with the Democrats now, at this point, that gets people what they need, and that gets the post office with the funding it needs, and that gets the state and local governments with the funding they need to save another 5.4 million jobs from going down the drain, they are toast all over the United States. Ads like the one I just envisioned could be run with language perfectly well justified by the facts of the matter and what the Republican Party is doing right here. The Republican Party is committing harakiri in front of our eyes. That is what is going on. I will entertain your comments in just a second. I'd like to do one more share screen. Specifically, I would like to remind you once again of my Patreon account. I'll give that the full screen so you can note that I am at patreon.com/Joe_Firestone. So let me now move to consider your comments. And where do they start? Steve says, I like it dark, less glare. Russell says, I'm keeping track of the numbers for my county. They are obviously being manipulated. Kay says, where are you, Russell? Now, Russ is in Georgia. I think, are you living in a suburban county, Kay, of Atlanta, Russ? And Steve says, the Useful Idiots did a good interview with the virologist that discovered HIV. The interview starts at 36 minutes. He believes that oral polio vaccine will work against COVID. Very interesting interview. Why does he believe that, Steve? I mean, can it attack the spike protein. Kay says, I'll have to check that out, Steve. I had that years ago in grade school. Steve's Gonzo says CDC numbers have been diverted through teletracker for manipulation. CDC has issued a disclaimer and cited delays as the reason. Yeah, it could be, but there are many sources that are directly in touch with hospitals themselves and is still getting figures. I don't think Trump can shut down hospital reporting or reporting on hospital websites. And those sites that are basically screen scraping the hospital websites all throughout the country can still get figures that are fairly accurate. Kay says, wait until they start finding people dead in their homes. Eviction will do that. Yep. Steve, the real tragedy could be the damages to the organs of the survivors, Kay, in the years to come. No one knows yet. I won't say that's the real tragedy. I think it's part of the real tragedy. In other words, it's not just the fatalities, but it's the illnesses, the chronic illnesses that many survivors will have for the rest of their lives. Steve says, how about that Axios interview? How about him reading his speech about the redwoods in the Yosemites? Steve Gonzo says, the schools that have opened are already contracting it. Steve says, the kids can spread that shit to grandma and grandpa. I know they can. That's why we haven't seen our grandchildren in months. We have not seen them literally in months. Axios interview, because we intend to live through this and to see them again. Axios interview was cuckoo for Cocoa Puffs. Yeah, I heard it was. Steve says, I mean suicide case. Steve says, correction. Do you mean suicides due to evictions? Kay says, no. Just people who can't afford to go to the hospital, as no insurance, so die at home. Got it. Steve says, 80% of COVID infections can be traced to workplaces where people earn low wages, elder care, food processing, bars, etc. Yes. And Steve says, yeah, the rich are hunkering down in their gated mansions. Kay says, Hoyer needs to go too. He's useless. He's worse than useless. He's worse than useless. He's always making deals with the fucking rich, okay, and the fucking corporations. Steve, the rich are hunkered down in their gated mansions, says Steve Wolfbrandt. And Steve Wolfbrandt says, I mean Steve, S-T-E-V, damn autocorrect. Kay says, love Barber. Got to know him when I was living in North Carolina. I'm not a churchy person either. Yeah, I love Barber too. I've been following him for years. Kay says, the FJG lady was on Rising the other day. The FJG lady is Pavlina Chernyeva. And Deborah Wilson says, Pavlina God. And Steve says, the TikTok kids will annihilate D. John. Steve says, I'm afraid the November election will be so chaotic there will be no clear winner. What then? There will be a clear winner. I think what you're saying, Steve, is there won't be a clear winner, okay, on election night. There may not be, but there may be a clear winner if the majorities are large enough and the majorities look like they're building. Steve says people will live in their cars, but many already do. Yep, but they got to go out to shower and they got to go to places to do that where they can somehow sneak a shower, okay, or get a shower. Kathy says, I've thought the same thing. Half the country will not believe the results, no matter who wins. Steve Gonzo says, we won't have to hit the streets. We'll already be in them. Kay says, I wonder about an actual civil war. Okay, and Lana says, Kay, Dr. Pavlina Chernyeva. Yes, Professor Pavlina Chernyeva. And Kay says, yes, Lana. Lana says she is a very nice lady. I really like her. And I second that particular motion. She is a very nice lady. Lana says, I saw the first video about Karen Bass. It was great. Thank you, Lana. I have 3 others I've cut that I'll be gradually dispersing this week. Probably the second one will be tomorrow morning. I've got them all done. I'm sitting on them. I didn't want to release them all at once. Kay says, yes, me too, Lana. She's very smart too. She's very, very smart. There are a number of very, very smart people in the MMT community. And Steve says, a friend's wife is positive because a guy at her job got sick but went to work anyhow because he couldn't afford but not to work. He infected everyone at the workplace. My God. Kay says, they don't want Bass as she might be but too progressive. SMH. What motivated that video was a piece at Daily Costs, where Costs specifically said Karen Bass is disqualified. After, mind you, about a week ago, or maybe it was a week and a half ago, he published a piece there where he argued in a very recent way that Karen Bass was the best choice, basically coming out in back of Karen Bass and saying she was his number one choice. And then a couple of days ago, or yesterday, I forget one, it comes out with this other article. He switched to Tammy Duckworth. Because Karen Bass had that speech for the Scientology nutcakes. So people won't forgive Karen Bass's giving a speech, which was all of about 2 minutes long, to the Scientology nutcakes but 10 years ago, but they will forgive Harris's tenure as Attorney General of California and as District Attorney in San Francisco. They'll forgive that whole record, which is a notorious record, which I covered here in a detailed article actually last week, but also more shortly in this other video. They are going to forgive that. And so Harris is still a viable candidate, but Bass is disqualified. Makes no sense. Utterly, Coss's article, latest article, made absolutely no sense. And after a closely reasoned first article telling us why Karen Bass would add something to Biden's ticket, Steve Gonzo, I noticed quite a few high-profile types saying MMT hashtag adjacent remarks like, we can't afford not to. Those are not very adjacent to MMT. They've been made by progressives for many, many years when something was necessary to do. Kay says, I saw a short video by Kelton explaining that textbooks would never change when he went off the gold standard, but that explains a lot. I'm not sure which short video you're talking about, but Steph did just a few days ago a 5-minute video, on the basics, of MMT, which I thought was her best short video thus far. It was really, I saved it. I have to get it, it's in my YouTube. I saved it, bookmarked it. It was a terrific 5 minutes. Really, really great. She did it for the BBC. It was a 5-minute the BBC piece She had so many of the key points there. It was amazing. She just did a wonderful, wonderful job. Steve Wolfbrand said, I don't think Biden wants a debate. Pretty sad situation. Well, if your one objective is to defeat the Donald, it may be a pretty sad situation, but it may be a pretty sensible thing to do. It's not something we should honor. It's not something we should boost. It's not something that we should encourage. But I perfectly well understand why he doesn't want to give Trump a chance to turn the tables. From a purely pragmatic point of view, but debating Trump when he's so far behind would not be a smart thing to do. Didn't someone say today that there was just a new national poll showing that he's 14 points behind now? Jesus. Kay says his campaign doesn't want him to debate, is what I saw. Kay says they're afraid he won't be able to keep his shit together. Yeah, maybe they're afraid of that, but also with such a big lead, it never makes sense to debate. We should force the politicians to debate. We need laws that would force them to debate, not give them the option. But without such laws, the smart thing to do, if you're way, way, way far ahead, is just say, I'm not going to debate. Why should I debate you? I mean, I'm leading by 14 points. I'm going to build that lead. I'm not going to give you a chance to catch up. Deborah says, I'm sad to hear they're having Sturgis, even still. I've ridden my bike out there twice from California. Wow. Kay says, hoping progressive candidates have a good day today in primaries. Yeah, me too. I am hoping too. Does anybody have any news on what's been happening in the primaries yet? Does anybody know how Cori Bush did? And Steve says 250,000 bikers to attend South Dakota's Sturgis motorcycle rally despite COVID-19. Kay says, hi, Johnny. Sorry, scroll too far. He says, hi, Johnny. Kay says, still working on getting my bank accounts down enough so I can get back on Medicaid in Ohio. Steve says, Trump hinted at expanded Medicaid. Biden would veto. Laugh out loud. I'm not sure Biden would veto expanded Medicaid. I'm not sure he would veto that. And Russ says, if we don't get the radical radical libertarian wing gone, we're all screwed. Yeah, with 22 senators sitting on their hands in the middle of the worst depression since the 1930s, and they're sitting on their hands and don't want to give any relief. I mean, that was Herbert Hoover and his buddies in 1929. Are these people back to 1929? They're acting like it's 1929 again. Johnny Garza says, hi, Kay, missed you all for a while. Kay says, missed you too, Johnny. Steve said, they're also starving the states. $0 in GOP stimulus. Yep. They're starving the red states too. And Lana Dell says, hello, Reed Russell. Who's Reed Russell? And Steve says, Doc, I'll send you the Loose Useful Idiots interview in Messenger with the virologist. Thank you, Steve. Okay, I'd love to have the link. I'd probably catch it anyway because I watched them at Useful Idiots rather regularly, so I probably would have picked it up anyway. But thank you. Johnny Garza says, this class war will get violent soon, but the casualties will be the rich. At that time, maybe things will change. Steve says, I'm considering writing in Jesse Ventura at this point. And Steve says, Amy's getting crushed by Mitch. Better have my money by design. Is Amy getting crushed by Mitch now? Are there polls that have appeared that suddenly show Mitch in the lead? Because the polls I've been seeing either show Amy with a 1-point lead or tied, or Mitch maybe with a 1-point lead. Steve says, we're not really surprised, are we? And Steve Gonzo says 2 more kids have died. Steve Wolfbrand says, any guesses on Biden's BP? By Kamala, Hillary, the Big Mike? The Big Mike? Who's Big Mike? Oh, Michelle Obama. That don't even mean Michelle Obama. Okay. I think that Karen Bass still has a pretty good chance. Okay, I also think Susan Rice has a pretty good chance. And Lana says, please post that 5 minutes video, Stephanie, okay, on BBC. Yes, I'll post a link to it so you can get it. And Steve Gonzo says they're above laws. Kay says, I haven't heard much yet concerning the primaries. Steve Wolfbrand says, Trump is right. He's right about hydroxychloroquine. You're joking, Steve, aren't you? Steve says, Amy is behind Mitch by 14 points. Really? Suddenly behind Mitch by 14 points? Johnny Garza says, nobody wins by violent revolution. Are those people in Kentucky crazy? Are they crazy? Look at what Mitch McConnell is doing to them. Johnny says, nobody wins by violent revolution. These are strong words for sure. I would consider taking arms against an oligarch. Radical? Yes, we're forced into this position. So let's go over to Politico. Let's see. Chris Kobach lost the Senate primary, okay, in Kansas. Oh, Trump has backtracked on mail-in voting, says it's okay to do it in Florida, but nowhere else. Oh, they got something else on Karen Bass. She gave a eulogy to a Communist Party of the USA leader, okay, by the name of O'Neill Marion Buchanan, as a friend and mentor in 2017, and she never mentioned his communist past. So now they're going to be red baiting her. They're red baiting her. Oh, how terrible! How terrible! So Roger Marshall beat Chris Kobach in Kansas by 12 points. Some of the Democrats were hoping that Chris Kobach was going to win because they thought they had a better chance against Chris Kobach. And I'm supposed to swipe for more results, but my swiping isn't working here. I wonder why. I suppose I could swipe if I was on the phone, but unfortunately, I'm not on a phone. Nor do I have a scroll bar on my computer. What good is that? Is there a link to it? I don't know. I can't see the Lacey Clay, Cori Bush thing. There are results in, oh, here it is. I can get the scroll bar. Here it is. Okay, Lacey Clay is beating Cori Bush with 25.38% of the vote in. At this point, 50.4% to 43.1%. Cori Bush is doing better than last time then. She's now within 7 points. There's a third party in the race who's got 6.5%, but she's out of it. And Rashida, with 0% of the votes in, is winning 62 to 64 over 31, 87, 66.3% to 33.7%. The top two primary in Washington for governor has 3 GOP candidates, but there have to be some Democratic. Oh, I see what's happening. I suppose the incumbent governor doesn't have to run in the primary there. So I think Jay Inslee, okay, is running again. So it's for the honor of running against Jay Inslee and getting slaughtered in the state of Washington. And for the U.S. Senate, okay, in Arizona, Martha McSally is running against Daniel McCarthy, and there are evidently no results yet for that. So those are all the results I have thus far. There's probably a special page on Politico for this. But I'm not catching it at this point. It's probably at the bottom of the page somewhere. Okay, I'm going back to your comments in just a minute. Here we go. Let's see what Breaking News Alerts has to say. Politico. Oh, nothing. That's nothing. That's not what I want. Digital edition. Ah, screw it. Okay, I'm going back to your comments now. Oh, Buttigieg is releasing a new book. Oh, wonderful, wonderful. So where I left off, Steve Wolfbrand says, looks like the turtle for 6 more years. Ugh. Well, it was Schumer who did it. It was Schumer who did it. He wanted to impose a candidate on Kentucky. He wanted to impose a candidate on Kentucky, and he succeeded. He almost lost, but he succeeded, and he got Amy, who has the charisma of a wet noodle. And people were supposed to believe she would do a better job than Mitch. Of course, that was a very low bar. She may still win. Why? Because COVID may run wild in Kentucky. And if Mitch McConnell is not going to deliver relief for those people at this point, if he's not going to make it possible for more Kentuckians to survive, there may be a bill coming due on November 3rd. The election in Kentucky is not now. It's on November 3rd. And McConnell is not playing this well in the Senate right now. Steve Gonzo says, quote, technical issue causing California to underreport coronavirus cases, unquote, state's top health official says, casting doubt on the accuracy of recent data showing improvements in the infection rate. This came from KABC. And Johnny Gart says, careful, friends, at what point do you draw the line between patriotism and treason? This is not the forum for such revolutionary discourse. So with that, and with much respect, I will no longer comment, but listen and learn. Thank you, Johnny. I hope you'll still be here. And Pete Buttigieg releasing a new book. And Steve Wolfbrand said, some labs only report on Wednesday. Russ says, I'm going to turn things off for the evening. Probably see you tomorrow. Great, Russ. Take it easy. Steve Gonzo says, 28-year-old Myra Ramirez became the first American COVID-19 survivor to receive a double lung transplant after irreversible damage. My God. Kay says, Knight Russell. Steve says, hashtag Missouri Medicaid expansion with over 50% in support, 50.6% opposed, 49.4% for. Steve Wolfbrand said a revolution would only work if the military refused to fire on the citizens, which, is doubtful. Well, it might even be worse than that. It might only work, if the military were actually to join the citizens and oppose the attempts to put down any revolution by the Department of Homeland Security, and local police departments. Steve says, good night, everyone. Yep. Good night, everyone. Have a great night. That's the end of the comments. And I think I'm going to say good night, too. Johnny says, good night, sir, and God bless you. God bless you, too, Johnny. Kay says, night, Steve.